Welcome back, everybody. Now we have our next plenary speakers. It's a team of really dynamic speakers led by our lead epidemiologist, Dr. Annette David. We also have Ms. Cara Rubio and Ms. Audrey Benaventi. Welcome, everybody.
Buenas yan half a day, and thank you, Sarah. It truly is great to see all of you, and we want to thank you for joining us for this session, which we have entitled Empowering Youth to Drive Tobacco Control Policy Change. And I am Dr. Annette David. I chair the Guam State Epidemiological Outcomes Work Group, and I will introduce the session and also do the conclusion. But the real stars of this session are my two co-presenters, Audrey Lynn Benaventi, who is the SO lead analyst. Audrey is a prevention fellow, did the fellowship under SAMHSA, and is working to get her graduate degree in counseling from the University of Guam. And Cara Rubio, who is now based in Pennsylvania, and she is a public health fellow at the Pittsburgh Foundation, but before that was working with the Healthy Schools program in Pennsylvania. Cara has a master's in public health from the University of Rochester School of Medicine and Dentistry, and they will be sharing some of the insights and lessons that we learned as we went through the Tobacco 21 process. So just two key objectives for learning today. We want to identify three key components of an effective communication strategy for tobacco control policy change. And we also want to describe the process that we went through and in this spectrum of creating change for prevention and for better health. I think we all started this because we were number one in Guam, but not in a good way. Back in 2015, Guam ranked first in the nation when it came to smoking and vaping in youth. At that time, 1 in 5 high school students were current smokers and 1 in 10 middle school students were current smokers. And the initial vaping data was truly alarming. We knew that 2 out of 3 of the current students started before the age of 18. We also knew that 1 out of 3 started between the ages of 18 to 24, so potentially they could be impacted by this policy change to raise the legal age of tobacco use, sales, and possession. And 1 in 3 high school and 1 in 4 middle school were current vapers. And so we thought at that time, Tobacco 21, that seems like a no-brainer. It was the low-hanging fruit, and it should be an easy policy accomplishment, right? Well, we were wrong. In July 2015, we had a champion in the legislature, and that was Vice Speaker B.J. Cruz. And he introduced at that time Bill 14133 to raise the legal age of sales, possession, and use of cigarettes, tobacco products, and vaping products from 18 to 21. In June of 2016, we were able to witness 9 out of the 15 senators who supported this bill, and the bill was passed. And we thought that that was a victory. But again, not so fast, because in less than 2 weeks, then Governor Calvo vetoed the bill. Why did the governor veto? These are his reasons, and we take these in quotation marks because they are the actual verbatim reasons he gave, that the government is not a nanny, and that as adults, we each have the right to make our individual choices, and that lawmakers don't have the right to tell Guam residents what they can do with cigarettes. And so the first lesson that we learned was policy change is a long process, and you will have some failures, but you must never give up. So we didn't. And in November 2016, there was a new set of senators who were elected. So an opportunity came up because 17 of the 15 senators who were voted in that year were completely new. And 4 of the 6 senators who voted no on the bill had been replaced. So this was the opportunity. We had not just the opportunity, but also the additional blessing that our champion, Senator BJ, was now the Speaker of the House. But we also had the challenge that the governor was still the same governor who had vetoed the initial bill. And so we had to combine, join forces and find partners. And the group that worked on this was a multi-sectoral group that included the Guam NCD Consortium, the Department of Public Health, the American Cancer Society. Of course, Guam Behavioral Health was at the forefront. And we also mobilized a lot of community groups to help us in this endeavor. We also knew that we had to be strategic after having failed the first time. And we looked at the art of war from Sun Tzu, and he had said, keep your friends close and your enemies closer. So we knew we had to be strategic in truly understanding who our stakeholders were in the legislature. And we also knew that we had to take a different communications approach, where before we first came up with the message and then hope that our audiences would buy and support our message, we knew we had to flip this around. And instead of a message based approach, we had to do a customer or stakeholder based approach, where we first made the time to truly understand each and every one of our audiences and then crafted our messages to address their particular concerns. And so the first thing we did was to really focus on our senators. Why the senators? Because very clearly, the action that we wanted to come out of this was to ensure that there were enough votes to get the policy voted into place, to get the policy enacted. And we knew it was important to provide the education and the information and the data to the senators so that they could make this informed decision. So we used a process of stakeholder mapping with our civic society partners, where we looked at all the different stakeholders who would have an impact on the policy change. And we included those who would be opposed to the policy as well as those who would support the policy, and categorizing them based on their interest in the issue, but also on their influence on the outcome of the vote. And then we looked at who we had to focus on so that we could achieve the greatest impact. And so we actually worked out our map, and we figured out that what we had to do was to concentrate on educating and reaching out to the new senators who still had not made up their minds on the bill, and two of the senators who were still undecided about how they felt about the bill. And we knew that we had to work with our community coalitions, our doctors and healthcare providers, and work with our youth groups so that we could empower them and we could educate them and convince them to support Tobacco 21. Seek first to understand and then be understood. And this is exactly what we did for that first go round. Why is this important? Because truly our audience is diverse and we need to understand each segment so that we can create change. Very importantly, even within that small group of 15 senators, they were in different categories, and you cannot reach them effectively with the same messages. You have to know their perspectives and you have to address their worldviews. So, tailoring the communications and information strategy to the characteristics of these important sub-segments within the legislature was very critical. You want each segment to do different things and you have limited resources, so you have to be strategic about which key stakeholder audience you need to convince to create change. And truly, there were three different issues that resonated. First was the personal rights issue, and then the military issue. If I can join the military at 18, why can't I use tobacco? And the economic issue. Will this bill have an economic impact on retailers who sell tobacco products and vaping products? And so one thing you'll notice here is none of the top three issues had anything to do with health. In the previous attempt, we were focusing on communicating the health impacts of tobacco and vaping. But it turns out what really concerned our key audiences was not health primarily, but really the issues of rights, the military, and economics. So this was a key learning, and this helped to inform our communications strategy. And then very importantly, and very humbling for those of us who had started doing this work, was when we thought about and reflected upon what was it that was missing from the initial campaign, we looked at who was at the table. And we realized a very key audience was not at the table with us in designing this communications strategy. This was a bill that would affect youth, and youth were not at the table. And it was at this point that we humbled ourselves and actually reached out to some youth leaders and really tried to empower them to take the lead on this information and communications outreach so that we could create the right conditions to facilitate prevention strategies and policy change to improve the health of our population. So this is when our champions came in. Cara and Audrey were at that time youth volunteers at Guam Behavioral Health and Wellness Center, and they were key to the success of this story. At this point, I'm going to turn over to Cara. Please listen to her as she shares with you some of the issues and strategies that they developed to make Tobacco 21 a success. Over to you, Cara.
Thank you. We can go ahead and advance to the next slide, please. So we'll be talking here about what are some of the tactics and strategies we use to create effective health messages, to get our stakeholders involved, and to do some education and changing of minds and hearts. Next slide, please. So a theoretical framework that we use when we think about changing people's minds or changing people's behaviors in public health, often we look at this one called the stages of change. And the stages of change is based on a premise that people have to go through different phases before they're ready to make a change. But if you look at this graphic and we reflect on the way we understand how behavior changes, what's something that we notice about it? In this graphic, there's only one person. And in this model, we're only considering one person at a time. Where is the individual in their stages of change? Well, we knew that we had to work not on an individual level, but on a community level. So what does that model look like? How do you get a community ready to make a change? And so we leaned into this model called the community readiness model. It's kind of like a ladder in that there are steps you have to move up. And this model is really useful about thinking about single issues and what are the specific strategies and tactics we can take. How do we focus our resources, and what are the tools that are efficient and expensive and easy for us to use on a community level to create some change. What we really liked about this model is it can be very specific to our community, to the people whose lives would have been affected by this policy. The most important thing about this model is the sense of community ownership. So when a change is happening, it's not because the government gets to decide and you're not part of a process, but because a community can really own and understand an issue fully before decisions are made about it. Next slide. So when we're looking about where was Guam, where was Guam at the point that Audrey, Dr. David, and I started working? Well, the first bill had failed, like Dr. David said. It failed in 2015, but the conversation had already started. So we were already, PDN was putting out polls about Tobacco 21 and how folks felt about it. There was reintroduced legislation, opinion pieces put out in newspapers. So people in our community had already kind of heard about this topic. And again, the conversation was starting up again. And we were, as a community, in the preparation and initiation stage. So there was some awareness of this issue, but we then needed to prepare and lay the groundwork for putting together strategies to deal with the issue. So what do we do about this now? And then moving into initiation, these are just examples of some tactics you can take it to move from the preparation stage to the initiation. So in initiation, we're thinking about what are the serious efforts we need to put into place so that we can get ready to make a decision together. What are the existing strengths? What are the assets that we already have? And then how do we redirect them to work on getting our legislators to support Tobacco 21 and getting them to listen to community members? community members' perspective on Tobacco 21 and particularly youth. Next slide, please. So we really focused on health communications, and that was a key piece. How, not just what messages are we going to send, but who is going to deliver them, who, knowing really well who our audience is, and thinking about tone, thinking about what are we responding to, not reacting, but responding, right? Taking the time to listen, to learn from challengers and from those messages. So health communications for us really bridged the gap and allowed us to move up the steps of that community readiness model ladder. Next, please. So again, it goes back to this difference of approach. So it's very easy to say we should pass a bill that says tobacco should not be purchased or used by someone under 21 because tobacco is bad for you, right? It's really easy to start with those messages and then think about how do we want to communicate them? What's the format we want to take? Next slide. But what was really important in our success is really thinking about going back to who are those stakeholders, who has the lever of power, who gets to make the choice at the end of the day, and what to them is important. Who are they listening to? Who do they represent when they go into the chamber to vote? Who are they thinking? Who are the people that they're picturing in their mind when they go up to make a vote on an issue on Tobacco 21 in specific? Next slide, please. So thank you. So with all of these, we came up with a series of strategies for how to construct our messages. So we'll go through them one by one. So the first strategy that we used is we needed to tell the story of tobacco use in Guam. We needed to show and we needed to put it in the context of what it does and what the families on Guam experience. So again, we knew that Guam was #1 in terms of youth tobacco use and e-cigarette use. But we also knew that on Guam, and because we had really great localized data collection, we also knew that on Guam, people who are addicted to nicotine, who use tobacco and e-cigarettes, they actually started smoking. Most of them started smoking or using nicotine products before the age of 21. So that's a really important story to tell. This 21 is not just an arbitrary number. It's actually a really important age for us because we know how long it takes for someone to get addicted to nicotine. And we know that of those who are addicted to nicotine in Guam, that they had the opportunity to purchase and use tobacco before they even reached 18. So that was a really important story to tell. And because we had local data, we were able to do that. Next strategy, or next slide, please. So our second strategy was to take a real-time pulse of public opinion. What do people think? People who kind of have a stake in the conversation, who have an opinion that they want to share, people who are like willing to share that opinion on polls. What do they think? And so there was a chance to look at another public poll that was done in the Pacific Daily News a second time. So after the bill had been reintroduced in the legislature. And we found that actually public support increased for the bill. So more people were engaging with the issue, and the people who were engaging with this issue were telling us quite strongly, you can see there's a clear majority here, that people really believe that the legal age should change. And they had a chance to comment as well, and we had a chance to learn from those comments. Next, please. Can you move to the next slide, please? Okay, thank you. So as we were listening to the places where people were having conversations about this legislation on Twitter, on the Facebook comments of a PDN article, as we're looking at the digital and in-person spaces where people were talking about this issue, we realized that we really needed to respond to some of the critiques and challenges that people were raising. So the strategy we used to respond is this method called LEARN. So LEARN stands for listen, explain, acknowledge, recommend, and negotiate. So we started out responding. This is an example of one of the messages we responded to. So if a person can join the military at 18, they can choose to smoke. Okay, so let me take a moment to listen to what it is I think you're saying, what I'm hearing you say. And then I'm going to explain to you my perspective. I'm going to explain it really clearly. So one of the ways you could respond to that is to say, the US military itself thinks smoking is dangerous. They've put out statements, their doctors, Navy doctors, Air Force doctors have actually said on record that tobacco use is a detriment to being in the military. It makes you less able to perform your duties. We know it makes you less healthy. And so that, that's a great that's a great example of explaining these messages. You also want to acknowledge, right? So you want to acknowledge that someone is raising a challenging message to you because there's a feeling of resistance there, right? So let's name that with each other. So you can say, we acknowledge that people have a right to make a choice about their body and about their health, but nicotine isn't just a personal choice to us. It actually affects all of us. And the reason we gave for that is actually a local insurance company who came to when the first bill was put out, who testified to say that it actually costs more over the course of a lifetime to treat somebody who smokes than someone who doesn't smoke. And so we know that cost, there is a real dollar cost to that, but also a personal cost, right, to our family members and people who get sick earlier in their lifetime because they are smoking. Next, you would recommend. So you share an idea that you have, or you share an example that changing policy works. So here we would use the example of when we changed the drinking age to 21, we saw a decrease in the number of youth who were trying alcohol for the first time and who are using alcohol, right? So that's a local evidence-based example of how policy can change behavior. And the last part of learn is to negotiate, right? So to come back together with a person who's challenging your message, right? Challenging your issue. And you ask them, what does it look like if we could prevent all these youth from getting addicted to nicotine in the first place? I want to know what you see. How do you think we can make that happen? What are the things that we have? What are our strengths that we can use to make that a reality here? So this is a really useful tool to kind of respond to these challenger messages. Next slide, please. So our fourth strategy is to really think about who we're speaking to. We need to have multiple messages for multiple audiences. So the way you can kind of create a type of strategy for the issue you're working on, and how we did it for Tobacco 21, was to think about who really are our audience, who are we creating messages for. So you do that through stakeholder mapping. You get really clear on what is it that you want each of these audience members to do. What's going to move them to act? What's the thing that's going to change their mind? What's the thing that's going to get them out of their seat and speak up on this issue? And what are the key benefits, right? So taking a really strengths-based approach. What are the things we can gain? Rather than focusing on things we're losing or things we don't have, weaknesses, we focus on strengths and assets. Next, we think about media format. How do we reach them? How do they like to take in information? Are they reading the newspaper every day? Are they having staff come to brief them? Are they tweeting? Are they super active on Twitter or different social media? And that helps us think about what type of engagement that person prefers. Then we go into the content, right? So after we answer those first two, we start thinking about what do we actually write? And how do we present the data? Because there's a lot of numbers and a lot of words, but it's great to be able to visualize kind of what we're imagining, but also setting the scene for what the problem is. And lastly, the intended outcome. So what is our goal? And being really clear with each message, there's a goal, right? There's something that we want to trigger or change. You can go ahead, thank you, into the next slide. So this is what our health community, oops, go back, please. Thank you. So this is what our strategy looked like for Tobacco 21. Here are our audiences that we help create messages for. So the first were community members. Then we had legislators and decision makers. We had community thought leaders. So people who are really influential, radio DJs, school leaders, folks who have influence over a large group of people. And then lastly, youth and general youth in the community, right? So for each of these, you can see we did different analysis of what are the things that each of them value. What do we want them to do? So we'll look at the second row as our example, right? So the legislators, the folks who are voting, what are some things they value? Well, they value having a job, right, in the legislature. They value re-election. They're concerned about the economy. We were hearing that they're concerned about the economy and that they didn't want to lose votes. So what was our strategy for them, right? We had to go back to telling the story of what tobacco addiction is costing Guam, but also what we could gain if we acted on it through policy. Our media format was a toolkit that Audrey's going to share in just a little bit and walk you through what that looked like. And our outcome was to respond to some of the messages they were hearing in the media, in the news that challengers were bringing up against the legislation, right? We wanted to help them visualize how passing this policy would create a healthier environment for families in Guam. And ultimately, we wanted them to vote yes on the bill and to make sure that it passed by a strong enough margin that it could not be vetoed. Next, please. And our fifth strategy is to think about who's delivering the message. And Audrey's going to tell you the story of how we work to empower youth to be the messengers and change makers. Thank you.
Hi, can we go to the next slide, please? Okay, everyone. So Dr. David talked about knowing your audience, and Kara discussed customizing the message to the audience. And now we're really going to tie it all together and talk about how we created that message so that it moves the intended stakeholders and advocates into action. And for this next part, I'm really going to go over the timeline of our Tobacco 21 efforts. Next slide. So just to recap, the bill had enough votes to bring it to our governor. However, the governor vetoed the bill and it was going to be sent back to the legislature to see if it would get an override. And that then prompted the stakeholder mapping. And it was realized through that the important group missing from the table were the youth. So if you look at this ladder of young people's participation, our efforts were really at rung 4, where the young people were assigned and informed. The youth were really just invited to attend the first public hearing and show their support. And then throughout our efforts, we really see it go from being assigned and informed to the youth being a part of the decision making and then seeing them move up the participation ladder. Next slide. So just some background. Youth for Youth is a community-based, youth-driven, and youth-focused nonprofit organization whose mission is to empower youth to live positive, healthy, drug-free lifestyles. After the stakeholder mapping, the Non-Communicable Disease Consortium's Tobacco Control Action Team had approached Youth for Youth Live Guam to ask them if they would be interested in joining the Tobacco 21 efforts. Next slide. So I'm sure many of you are familiar with the SAMHSA Strategic Prevention Framework, and I'm going to talk about our efforts through this process. It was important for the youth to be a part of the entire journey for Tobacco 21, but it was also important that everything that we did, from the youth getting brought on, was strategic and had purpose. So it wasn't just showing up in big numbers at the public hearing, right? But it was also taking the time to listen and address the issues that both the legislature and the community were voicing their concerns about. And then we use that to drive our efforts and effectively communicate our message. And it was important that we mobilize the youth because later on down the line, they were fully equipped to mobilize themselves and they really took on this project. Next slide. So we assessed the current environment surrounding tobacco control policy, right? We looked at who had passed Tobacco 21 laws, and at that time it was only 2 states. We looked at what does local data show, and at that time it showed that Guam was the highest in the nation for tobacco use. We looked at the potential impacts of Tobacco 21. You know, what were the policymakers saying? What were the communities saying? There were several concerns brought up about raising the age that we'll definitely get into later on. Next slide. And then we looked at, do tobacco control policies make a difference on the island? And then according to this, this graph taken from Guam's epidemiological profile, it shows that when a tobacco control policy was passed, youth tobacco use decreased. So when we look at capacity building, we looked at our current resources at the time. We had a great group of stakeholders ranging from faith-based, sports-based, LGBT, school-based, and they had a wide reach of individuals, particularly youth. So we invited over 10 youth-serving community organizations to a Tobacco 21 Education Day. And it was important to educate and engage the community organizations on the impact of Tobacco 21 and the current status of the bill at the legislature. Next slide. And so at the end of the workshop, the community organizations discussed how they would continue to educate and inform their stakeholders. And the outcome was twofold. It was a commitment from the organization, so where Youth for Youth would meet with senators, and the rest of the organizations would then garner support through petitions and public testimonies. So after the public, next slide. After the public hearing, the education day, where it was decided that Youth for Youth would meet the policymakers, we wanted to definitely have something tangible to give to the stakeholders. So that came the development of the Tobacco 21 Toolkit. And it was a research-based toolkit that was disseminated to policymakers to provide education on the bill. It provided information on e-cigarettes, legal precedents, risk factors, the economic impact, and of course it had data on tobacco use. And we'll just go over a brief overview of the toolkit, and then I believe we can provide a PDF version of the toolkit if it's wanted. Next slide. So these topics stemmed from the concerns that the senators had brought up during the public hearing, because their concern wasn't just health impact, as Dr. David had said. It was really, they wanted to know about e-cigarettes. They wanted to know about other places in the US that had passed Tobacco 21 laws. And then as Dr. David said, one of the biggest arguments against the bill was, if a person can join the military, who are we to say that they can't smoke? So we really took the toolkit and we broke down some of those concerns in relation to the military's response to tobacco use. A lot of the senators wanted to know about the economic impact. So we actually partnered with a local insurance company, and they provided a brief view of a health expense of a smoker's smoking-related illness to a non-smoker. And of course, a smoker's related illness costs more than a non-smoker. We even put how much a pack of cigarettes costs on Guam, because not many of them knew that at that time, a pack of cigarettes cost around $7. And then of course, we presented the most recent data on youth and adult tobacco use. We hand-delivered these toolkits to each senator. So the youth strategized and tailored the conversation to the interests of each senator. And this really led to more meaningful and successful conversations. So the senators, they asked them questions. Why do you want this? Why is it important to you? And we really didn't have a set script for them, for them to say to all the senators. So the youth were really able to speak from their heart and answer genuinely. And that was vital. And that is why it was vital that the youth had been part of the entire process, right? Because they were really able to, voice their opinions about the bill. And then on top of the meetings with the senators, the community organizations had submitted petitions in support of Tobacco 21. Next slide. And then the youth were also interviewed on radio stations about their involvement with the bill. They were asked the same questions. Why do you want this? Why is it important to you? They posted polls on their social media, regarding the bill. They talked about being a smoke-free generation. And one thing I like to share is that their media presence were so impactful that when the senators were brought on to radio stations to talk about tobacco, to talk about topics that were really unrelated to Tobacco 21, the radio personality would always throw in the question, do you support raising the tobacco age? How are you voting? And that just showed that the youth really started the conversation. So were we successful? Actually, no, we didn't get enough votes to override the governor's veto. So we were unsuccessful, but we went back to the beginning. And that's the beauty of the SPIF process, right? It's a continuous cycle. we went back and we assessed our efforts. And, it turned out that that year, as Dr. David had mentioned, was an election year. So we strategized until the new legislature came in, and we did our efforts only better and louder, and were more strategic. And we learned about the new senators, we strategized our meetings, we learned about their interests, we recruited more youth, and we definitely had more interviews. And so the second time around, next slide, we were successful because the bill passed unanimously. Next slide. And we went from the youth being assigned and informed to them being a part of every decision that was made. The youth really took Tobacco 21 and made it their own. And I think that's what shocked the senators, is that the youth were the ones that were calling them to meet. They were the ones attending every meeting, and they were making sure that they were heard. So what did we learn? We learned that you have to be consistent, persistent, and insistent, right? We defined what our expectations were. We defined what being successful looked like, and that was Tobacco 21 passing. And we never lost sight of that. And we worked smarter every single time. We were persistent. We knocked on every door that would answer, even maybe if they didn't answer. We had a never give up mentality, and we were forward thinkers. So we thought with the end in mind. And we were insistent. We were definitely insistent. We were committed. And I think the best part of what made this so successful is that we had a great group of individuals who are prevention champions, whose heart was in this. And that really made a difference because the passion was there. And then I'm going to turn it over to Dr. David to finish off the presentation.
Thank you so much, Kara and Audrey. Every time I hear this story, I always get excited because it truly is a living document of how empowerment is so successful. I think in summary, what we learned was policy advocacy and communications is a complex process. But with a strategic approach, it can actually be very effective. But what is key is to know your stakeholders, both the supportive and the obstructive, and understand what it is that they value so that you can tailor your key messages, your key communication to specific stakeholders and address what they value, and in that way convince them to be prevention champions. It's important equally to select your communicators strategically, and in this case, the best messengers were the youth, and they were spot on. And truly, this needs us to switch the way we think and truly empower the youth to lead the way, to trust in our youth, and to let them share in the decision making. And I know that we have some folks who have raised their hands, so we'll have a chance to talk and get to your questions and comments. But let me just very quickly end this by saying that youth empowerment works. And in fact, youth empowerment should start early. Kara and Audrey started out in prevention when they were babies, and they grew up with us. And I really like to think of youth empowerment as succession planning. For those older folks in prevention, we need to think about who to hand the baton to as we get older. And it's never too early to start. So you can see both Audrey and Kara here when they were kids already starting the empowerment process and being prevention champions. There were people that we also have to acknowledge. Bobby Benavente was the supervisor, Audrey's grandmother, and she started a lot of the work, including the SOE, back when she was supervisor at prevention and training. We had Kathy Castro and Peter Cruz, who were strong community advocates for prevention and tobacco control. And of course, the rest of the team that provided the backup and support from the different organizations, the Department of Public Health, the Guam Behavioral Health, and American Cancer Society. So it was all about working together, but letting our youth lead the way to guide us. And what's happened since? That bill is now law. You must be 21 to buy tobacco products here in Guam. And what we've seen thus far is it has led to a continued decline in smoking rates amongst our youth. And we have even been able to document a decline in smoking rates amongst adults. So for both youth and adults, this policy has had a clear and measurable impact. The vaping data are still high. We need to do more for vaping, but clearly for smoking, this policy was a winner. I'll end by saying that Nelson Mandela, he said, the youth of today are the leaders of tomorrow. But our experience in Guam, I think, with all due respect to Mr. Mandela, shows that he's wrong. In Guam, we say the youth of today are the leaders of today. So thank you so much, everyone, for joining us. And I think we have time for questions. And I know some folks have raised their hands. So Sarah, over to you. And let's have our conversation.
Hi. That was a great presentation. We have a couple of questions on this one. So the first one is a feedback and a question. It says, "It's so amazing to hear that what difference you can make for our island, but what's the next step from here?"
All right, so Kara and Audrey, I'll let you take a first shot at this.
I no longer live in Guam, but I still, definitely consider that my home. And I think this message holds, but including youth at the decision-making table is really important. And I think the more we build that into the way that we think about behavioral health and the way we think and work on mental health and addiction, the more successful our programs can be. And not just asking youth what they think, but really allowing them the space to imagine what the solutions could be too, because we have a lot to learn from the youth on our island. And I think they're really creative and can need those opportunities to show how much they care about the community, right? And want to be able to participate and be active in this process, because it affects more than just adults on Guam, right? It affects families, all the issues that we're working and discussing today.
Audrey?
So just to go off what Kara said, I mean, there's a lot more work to be done in terms of tobacco control policies. And I think one of, as we had mentioned that the community input, especially the youth input, is so important. And I think just making sure that the community is at the table and the youth is at the table just makes a difference in the world. Because I can tell you that the senators, I really don't think the senators are ready for, the youth to be the ones coming into the meetings and asking them, so how are you voting? This is important to us, and what is it going to take for you to see that? What is it going to take for you to understand, the impact that this is going to have on the community? So definitely the next steps, I hope, is more tobacco control policies. Our rates are low, have decreased, but, of course we want them to decrease even more.
That is such a great point, Audrey, about the civic responsibility and how youth can play such an impactful role in holding our elected leaders to account, right? We sometimes forget that our elected leaders are in fact there to work for the community and not the other way around. But it's important to hold the mirror up, and youth are very effective in holding elected leaders to account, and that's a very critical function. If you ask me, I think vaping is going to be the next frontier. Our tobacco rates have continued to go down, even for smokeless tobacco use. Smoking and smokeless use are now very low here in Guam, but the vaping rates are horrendous. And in a recent WHO publication, Guam has one of the highest vaping youth rates in the world, not just in the region, but in the world. So I think maybe that might be the next frontier where we need to challenge our youth to take the lead and help us design the effective strategies to reduce that big risk. And I think COVID has highlighted the huge risk from vaping. Back to you.
So we also have another question here. Can you hear me?
Yes.
Okay, yeah. So it says, "I'm wondering if tobacco industry indifference played a role when Governor Calvo vetoed T21. So what strategies did Guam use to tackle, if there's any?"
That is such a good question. And I think the tobacco industry interference is always there. I think we always need to think, how we talk about social determinants of health, right? Well, one part of social determinants are the commercial determinants of health. There are a lot of institutions and businesses out there that profit from unhealthy products like fatty food or turkey tails or tobacco or e-cigarettes. And so I think this was a nefarious presence that was always in the background. And they were, I believe that they were in fact feeding some of the conversations with the standard tobacco industry arguments against policy change. But I think what was key was mobilizing the community and mobilizing the youth to counter all of these messages. And I think Kara's description of the learn approach really was instrumental to helping to show how very invalid the tobacco industry arguments were. Plus, the community mobilization, whenever a survey would come out, I know that the youth would spread out the message and the links to all of their contacts so that we could get a lot of that support showing up on these newspaper surveys. And that was important to show that the community was standing strong against tobacco. And so these were some of the measures that we took. Remember that the tobacco industry is not just the big companies, you know, Philip Morris, but also the smaller companies, because in our islands we don't see the big companies, but you do have tobacco retailers, you do have people who sell tobacco, and the industry is always working through these local phases to combat policy change. So we as community members, we need to be more vigilant and more creative to combat them.
Thank you. Okay, due to time constraint, we're gonna have like one more questions before we close it out. This one is asking, how do you address individuals 18 to 21 where of a mindset, I'm old enough to risk my life for freedom, but my freedom are limited? I think it's relating to the military that we mentioned earlier.
All right. So Kara, since this is a youth question, Kara and Audrey, what are your thoughts?
I think I would say that all choices have consequences. And I think like what was successful for us was thinking about not just what are the consequences for an individual who smokes before the age of 21 or who vapes, but what are the consequences long-term for their family? What about for their community? How does it affect them? How will it affect our economy that that people are making money so that that groups of people on our island, you know, where it's sorry, I guess I'm saying, like, you know, it's easy to make that choice, right? When you don't have taxes and when you don't have people checking ID at the counter. But when you put these structures in, you make being healthy the easier choice. And that's something we need to incentivize as a community, because we all benefit when our community is healthier, right? Like we all benefit when our grandparents can live longer, when our parents can live longer so they can meet our kids. And we do have like that sense of care for our community, I think, in our culture. And so I would just say, like, you do have, as an individual, you have a right to make consequences, but you're not free from the consequence, or you're not free from the consequences of the choices you make. And it's not just your health, but it's also who's going to take care of you when you're older, and if you get sick, you know, like, can you afford the medical costs, and what does that mean when we're looking at a population and not just at an individual?
Audrey, your thoughts?
You know, as Dr. David, you said, everyone has a role, right? And that really stays true to me, especially now because I have a baby. So you know, everyone does have a role. You know, it may be your individual choice, but you have to remember that you're always going to affect someone or something, right? There's always going to be, you know, something stems from your actions. You may choose to smoke, but then as Kara said, that has a ripple effect. It has a ripple effect to, the economy, as we had said, that the insurance company had said that there's a high costs related to smoker related illnesses. So everyone has a role to play, and it may be your choice, and yes, but you have to remember your actions affect other people.
Yeah, very
We're-
wise words. And I would add to that, if you talk about freedom, nicotine addiction is the very opposite of freedom. So if you truly believe in freedom, you will support tobacco control because addiction is the takeaway, is that holding your freedom hostage. So I think that maybe that's another insight. If you really support freedom and you really want to fight for freedom, you will fight tobacco. You will fight nicotine because you don't want addiction.
Great answers. All right, with that, I want to say thank you all. On behalf of the Peace staff, I would say thank you all for taking your time to present. And that was just a wonderful, great presentation and very insightful. With that, we're gonna ask the audience if they can come back at 11, take a 10-minute break to stretch out. But once again, thank you all. Thank you so much.
Thank you. And thanks for the chance to share our story. Thanks, Kara. Thanks, Audrey.
you. Bye. Thank you so much.